So welcome everybody to a unique session. This is sort of a new thing for SAGES this year, where we are together going to design quality metrics. You can decide what matters. So these are my disclosures, not related to this talk. Measuring quality in surgery remains a challenging proposition. Our electronic medical records are not interconnected, so communication is often hampered. Data that's easy to collect mostly focuses on death and destruction, so to speak, right? So mortality and serious morbidity, and readmissions, 30-day readmissions. But that's about all we can easily get out of our electronic records. Ideal quality metrics should be patient-centered, not hospital or physician-centered. It would be different for different types of procedures. So not one metric doesn't fit everything that we do in general surgery. We have absolutely no agreement on what we should be measuring, and how to collect the data and keep it remains problematic. So there's clearly an appetite for determining quality, and this is sort of the alarmist message, that if we do not define quality ourselves, then outside forces who may not align with what we believe is quality are going to define it for us. This is coming. The government is already looking at ways to tell us how good or bad a job we're doing without any evidence to support it. We're being ranked now. I'm sure you guys have gone on the internet and looked at Google or Yelp or one of these rating services. We all have ratings on the internet. My parents called me and said, "You're a 4.6 on Google." I'm like, is that good? Is it bad? Is that, scale 1 to 5, 1 to 10? So it's out there, whether or not it's accurate. Other disciplines in surgery are way ahead of us. Thoracic surgery have been creating quality metrics for 20 years, and they define metrics in the area of thoracic surgery. Vascular surgery has been doing it for 10 years. General surgery, we haven't even started. So this is an opportunity to begin to develop quality metrics that actually really measure the outcomes we seek. So this is different than what you've done before. We realize it's the end of the day. We wanted to make this interactive and enjoyable. We have a couple of short talks, and then we're going to just sit at these round tables in working groups, and we are going to develop quality metrics. And if we come up with something new or novel, we may even write this up into a manuscript based on your brain power. So this is going to be a thinking session. So our objectives here are to get a sense for the challenge in defining quality metrics in general surgery. We want to think from a disease-focused viewpoint, so we're going to pick a couple of areas, and some of the talks will get into this. We're not going to have everybody working on one operation or one area. We'll do a couple. And we're going to understand a little bit about how we're measured currently, and most importantly, let's try to make this into a fun session.